Good evening, everyone. I'm Tony Segreto, and once again, so very honored to be your moderator for tonight's In the Know Town Hall. We welcome you to our third town hall in our series called The Science of Aging. Now, previously, we have focused on how to protect our brain and skin health as we age, but tonight, we have something very different for you. Now, we're going to focus, and no pun intended here, honestly, no pun intended, but we're going to focus on something very appropriate for 2020, and that's our vision. The human eye is our gateway to light, to depth perception, and to millions of shades and colors and beauty. And tonight, speaking of beauty and brilliant minds from the Bascom Palmer Eye Institute will help us explore ways to protect and improve our vision as we age, and the latest treatments for some of the common disorders and diseases of the eye. We're even going to discuss some of the new technologies at work, including artificial intelligence, and how about this? The fascinating prospect of transplanting an entire human eye. That's right. Our panelists tonight include some of the most prominent experts in ophthalmology. Joining us, Dr. Eddie Alfonso, the director of the Bascom Palmer Eye Institute, which serves as the Department of Ophthalmology for the Miller School of Medicine, which Dr. Alfonso also chairs. He will take part in the question and answer session tonight, along with Dr. Jorge Fortun, who is a world-leading retinal specialist. Dr. Reina Habash, an international health technology expert who can share the latest on cataracts, dry eye, and glaucoma. And Dr. Byron Lamb, a neuro-ophthalmologist who specializes in inherited genetic diseases and other cutting-edge technologies. As you can see, it is truly a world-class group of experts. Now, before we get started, I want to go over how you can participate in tonight's conversation. After Dr. Alfonso has delivered his opening remarks, all panelists will answer the questions that you've submitted over the last few days. But you'll also have the opportunity to submit questions during this program. So what we want you to do, for those of you who have been with us before, you know the drill. For those of you new to the In the Know series, look at the bottom of your screen. You're going to see a Q&A feature there. All you need to do is send us your questions. All of the questions you send us will be submitted anonymously, and we promise we're going to get as many in as we possibly can tonight. So let's not waste any more time. We have a lot to go over. Let's get started. It is my honor and it is my pleasure to introduce Dr. Eddie Alfonso. And Dr. Alfonso, so excited about tonight, and I know you have so many things to talk about. Great.
Thank you, Tony, and good evening, everyone. It's wonderful to be here. And I'd like to start by acknowledging my colleagues from the Bascom Palmer Eye Institute. They are truly an extraordinary team of ophthalmologists, researchers, educators, and a staff who dedicate themselves every day to making Bascom Palmer the nation's #1 eye hospital. As many of you know, we've held this honor for 17 consecutive years and 19 overall years since this ranking started. We're proud to be recognized in this way, but even more importantly, we're proud to be recognized as a world leader in preventing and protecting the gift of sight. Our faculty of internationally renowned physicians and scientists have revolutionized the understanding and management of nearly every disease affecting vision. That means that we're able to speed effective interventions and treatment for our patients. Our research programs are exceptional. Our training programs offer ophthalmology education for students who are our future. We're pushing the frontiers of research, patient care, and education on every level. The experts joining me tonight are ophthalmologists who also have special expertise in a range of areas. We will hear about the newest advances in cataracts, dry eyes, glaucoma, macular degeneration, retinal diseases, and much more. We're thrilled to be answering your questions tonight, and I really look forward to our conversation. Tony, back to you.
Doctor, thank you. So let's move into the Q&A portion of this event because we have so many questions that you already submitted. We want to get to those first, and we will be adding in the questions that you send in during this broadcast. So our first question, Dr. Habash, welcome. It's for you. The question is, what can we do to keep our eyes healthy over time?
Well, this is a perfect question to start off with. So number one, see your ophthalmologist once a year after age 50. That's the first thing, because many of these eye diseases that we're going to talk about today are sort of silent, which makes them a little bit dangerous. You know, you wouldn't even know you have something like macular degeneration or glaucoma until it gets really bad. So if you come to see one of us, we can tell you and we can catch it and start treatment right away. That's number one. And number two, really easy, thing to do is wear sunglasses. Sunglasses make your eyes a lot more healthy and keep some damage away. Eat a lot of green leafy vegetables and a healthy, balanced diet. No smoking is another really good tidbit. And I think those are the main ones. Dr. Alfonso, do you have anything else to add?
Ryan, I think those are the most important ones, and I tell you the most important thing that you can do is really to have an eye exam that can for the long term. So those are it.
Dr. Alfonso, this next question is actually for you. What are the most common causes of blindness, and what advances are being made to restore sight?
So the big ones are diabetic retinopathy. So for those people out there who have diabetes, it's extremely important to take good care of your diabetes because it can lead to blindness. Glaucoma, and glaucoma can come in the way of an inherited disease. So if there's anyone in your family who has had glaucoma, it's important for you to get an eye exam. And macular degeneration. Macular degeneration, again, also runs in families, and it's a disease of us, the elderly, and I include myself there. So those are the big diseases that we need to try to deal with because they can lead to permanent vision loss. Now we're going to discuss some other diseases that have reversible vision loss like cataracts and other things that we will talk upon in a little bit.
Thank you, Doctor. Dr. Fortune, are there any new options for glaucoma?
Tony, I think I'm going to kick that question over to my partner, Rania Habash, to talk about glaucoma, but I'll touch very briefly upon what Dr. Alfonso said and what Dr. Habash said, because you mentioned a way to keep your eyes healthy and some of the leading causes of blindness. And I'm sure we'll have some questions about macular degeneration, but certainly maintaining overall health is very important for your eyes. And we know that with macular degeneration, as we get older, as Dr. Habash mentioned, it's important to visit your ophthalmology on a yearly basis to have retinal exams, which is what the macular degeneration disease affects, maintain good nutrition, and these are things that our patients can do. But as far as glaucoma is concerned, I'm going to kick that over to Dr. Habash.
All right, great. Okay, so here's my layperson's explanation of glaucoma, because this is kind of confusing for people. Glaucoma is like the tire pressure in your car. You want to have a certain tire pressure, right? It needs to be in a certain range. If the tire pressure is too high, the tire gets hardened. And that's the same sort of thing that happens in the eye. So if the eye pressure gets too high, then the walls of the eye get too hard, and there's pressure put on the optic nerve, which sits in the back of the eye. The optic nerve consistency is sort of like a marshmallow. So any extra pressure compresses it. And that's what causes nerve damage over time. The nerve damage is pretty irreversible, although Dr. Lamb might tell us about some new techniques that might preserve some of that. But that's why it's really important to get a good health exam or eye exam, because you don't even know this is happening. And that's really the dangerous part about this. That's the insidious part, is that you can walk around and not even realize that your pressure is high and have this nerve damage over time. So, there is a small subset of people who have normal tension glaucoma. It's about 30%, but that's the sort of way that glaucoma works. Now, in order to treat it, we just got to decrease the pressure. So there's a couple of different ways we can do it. Number one, we use eye drops, and the eye drops will decrease the pressure in the eye. Usually that's pretty good because we have some really good eye drops. But if we need to go to something else, the next level would be like a laser treatment that increases the filtering of that pressure. And then the third sort of stage of these things is a filtering procedure or stent. And at Bascom Palmer, we invented actually one of the stents used in glaucoma. So that actually takes some extra pressure out of the eye as well and normalizes the pressure within the globe. So that's it in a nutshell.
It's fascinating. Absolutely, absolutely fascinating. Dr. Lamb, you're up, and welcome to to our event tonight. Is there any significant progress for treating retinitis pigmentosa?
Well, I think there's really tremendous progress that we have made. So for a long time, we have no approved treatment. In 2017, we have the first ocular gene therapy, and that particular ocular gene therapy is for early onset type of retinitis pigmentosa, which is also called Leber congenital amaurosis. But basically, this type of RP, retinitis pigmentosa, is a very severe condition. It's called RP65, and a patient is born basically blind, and this blindness is noted during the first year or two of life. And with this established treatment approved, patients as young as 2 years old have been treated in our eye institute with very good results in both eyes. There's so many different type of approaches that people are trying to treat retinitis pigmentosa, which include gene therapy, which include other modalities, oral agents, injections. So I think the future really looks very bright.
Thank you, Dr. Lam. Dr. Habash, we're going to come back to you. What can cause dry eye and what can be done about it?
Everything can cause dry eye. So this is the number one question I get all the time. So first of all, dry eye, I'm gonna be full of really funny analogies because I'm from West Virginia and we just talk really plainly. But dry eyes, you can think of it like the windshield of your car having a lot of gravel on it. And so your eyes feel gravelly. That's why it's really uncomfortable. What do you do when your windshield has gravel all over it? You put your windshield wiper fluid on. And that's what artificial tears are for. So they kind of wet the windshield of your eye so you can see better and you feel much better. But all kinds of things cause it. It can be the vent when you're sleeping at night, blowing air on you. It can be the fan at work. It can be, if you're in the hospital, the dehumidified air. And then I'll tell you the number one thing, Tony, that has really been causing our patients a lot of discomfort is the mask. I'm not saying not to wear a mask. I'm just saying that the mask definitely has increased everybody's sense of dry eye these days.
Well, it certainly does fog up your glasses when you're wearing it. And
yes, that's for sure. Yeah.
But thank you, doctor. I had no idea you were a mountaineer. I mean, absolutely.
That's right. Yeah, Well, I have one more way that we can, a couple more ways that we can treat the dry eye if you want to hear them, because I know there were a lot of dry eye questions actually today. So the first stage is the windshield wiper fluid, right? The second one is, second thing I do. Now, if you think of your eye sort of like a sink, what do you do when you want to wash the dishes in the sink? You put a plug in the drain of it. And so the water level rises. And that's a really successful thing that we do. It takes like 10 seconds to do this. We put a tiny little sponge or a tiny little plug in the drain of the eye that lets the water level back up on your eye and decreases the dry eye. That's awesome because now when you put in the artificial tears, they stick around a whole lot longer. So that's usually my second line of treatment. And then the third line of treatment is more of an immunomodulating drop like Restasis that a lot of people have probably heard about.
Thank you, doctor.
You're
Dr.
welcome.
Alfonso, with the ongoing pandemic, is it safe for our eyes to use the antimicrobial blue lights as a precaution?
Our emergency room at Bascom Palmer has seen a few patients who have had what we call superficial keratitis or a corneal type superficial burn from these lamps because of the type of ultraviolet light that they emit. So I would tell our audience to be very careful about using them. Don't hold them close to your eyes. And if you're going to use them, make sure that you're not using them continuously, but just occasionally on a surface that you may need to clean. And there are many other ways to clean a surface that is not an ultraviolet light. So I would say that if you can use one of the other methodologies, do so, because it may be safer for your eyes to not use the ultraviolet lights.
Dr. Alfonso, we're going to stick with you here. We just had this question sent into us. If you only have vision in one eye, is it worth it? And is it risky of having cataract surgery if it's not absolutely necessary?
That's an excellent question. And I would say this, The reason we suggest to a patient to undergo cataract surgery is because they're having lifetime functional problems. So that means that you cannot do the things you want to do in life because you can't see well enough to do them. And so my grandmother probably sat in a rocking chair in the front porch of her house, and all she needed to see was the cows working their way out in the pasture. So she never needed cataract surgery. I would say that today, if my grandmother had only one eye, she would probably be reading the computer that's right in front of me, and she would say, Eddie, why don't you do cataract surgery on me? Because I have to look at the computer. Or my grandfather, who may have one eye, would say, Eddie, I have to play golf and I can't see where the golf ball is landing, even with the best glasses that you can give me. So it all depends what you need. If you're seeing well enough to do the things you want to do, you don't need to have cataract surgery unless there are very rare situations where a cataract can be causing secondary things like glaucoma, or the doctor may need to see the back of your eye and the cataract is not allowing them to do so. And in that case, it may be suggested, but otherwise, it's not worth the risk.
Great. Thank you so much, Dr. Alfa, and well put, by the way, well described. Dr. Fortune, is there any way to prevent age-related macular degeneration?
Yeah, that's a good question, Tony. And I think for our audience, I'll briefly talk about age-related macular degeneration by starting by saying the macula just is a term that defines the center part of the retina. And the retina is the film in the camera. It's the sensor in the camera. It's that nervous tissue that lines the back of the eyeball and helps us see. And the macula is the central part of that. And the reason it's called age-related is because the most common form of macular degeneration is associated with age. As some of us age, the sort of products of the wear and tear of all the years accumulate in these tissues and lead to dysfunction. And so the answer is, can we prevent macular degeneration? You cannot prevent it. It's a disease that is usually has some sort of inherited quality and is also associated with lifestyle that really, is the day-to-day living that most people do. So a majority of people are at risk for macular degeneration. While you cannot prevent it, there are certain ways to treat certain forms of macular degeneration. And once you have the earliest form of macular degeneration, which we term dry macular degeneration, I saw some questions in the chat related to vitamin supplementation. Once you have the dry form, then the best thing that we recommend is taking a vitamin supplement. And these vitamins can be found over the counter at your local store. And they have a funny name. They're called AREDS. And the AREDS is an acronym for a study that looked at the role of vitamin supplementation in slowing down or preventing the progression of disease. So to answer the question that was in the chat, the best thing you can do, while you can't prevent macular degeneration, is if you're diagnosed with early dry macular degeneration, is to take AREDS supplements or AREDS vitamins, because it has been shown in large studies to decrease the rate of severe vision loss in these patients. So that's the best recommendation we make. Additionally, as Dr. Habash noted, some lifestyle changes, particularly if you're a smoker. Quitting smoking is probably the best thing you can do overall for your health in general, but certainly it's one of the best things you can do for your eye and macular degeneration in particular. And then nutritional choices. We recommend eating green leafy vegetables, so spinach, kale, other sorts of greens. We know that fish, which have essential oils, can help with this. So those are some of the changes you can make to prevent the progression of macular degeneration.
Thank you so much, Dr. Fortune. This is so fascinating. Dr. Lamb, are there any studies being done right now in the regeneration of the optic nerve?
There's a lot of good scientists who are working on the regeneration of the optic nerve. The optic nerve is like a fiber optic cable that connects the eye to the brain. So in fact, we see with our eyes and we see with our brain. Our eyes are like cameras, and then the optic nerve is like that critical cable that carries the nerve messages that serves our vision. So I think what we have learned about optic nerve regeneration is that optic nerve fibers can regenerate in the lab, and typically a percentage of them can grow back. I think right now the challenge is actually to make them go to the proper place, to connect them to the proper area of the brain. So I think there's a lot of hope there. I think there's more control now in terms of where these fibers do go in the brain. There is still some work that's necessary, but I think there's also a lot we have learned about how to add special proteins or ingredients that can actually make these fibers grow faster and then give them the ability to, in fact, grow back. So I think there's a tremendous amount of research in this area.
And Dr. Lam, while I have you here, are stem cell therapies being used for macular degeneration?
Well, that's something that Dr. Fortune can answer maybe better than I do. What I am aware of is that there are some very early studies that are in phase 1, and that's for people with very severe loss of vision, including AMD. But I also want to mention that these stem cells are early, and stem cells have a lot of potential. So I think down the line, we will learn more about the treatment, and they do have potential to give vision. However, we have a lot to learn. I also just want to mention that you have to be careful what you read on the internet, just because there's a lot of stem cells that are not really regulated by the FDA. And when you read about it, if there is a if there's a stem cell and the advertisement is that this is too good to be true and you have to pay thousands of dollars, that is not an FDA regulated study. So we have to be very careful with that. But going back to good science, I think stem cell has really a lot of potential, and now people have learned really to harvest stem cell even in adults, in all of us. So in that way, we have great potential for this as a treatment.
Yeah, Tony, if you don't mind,
I was going to ask you if you wanted to weigh in on this.
yeah, and I think stem cells. I must be asked about stem cells at least on a daily basis. By the nature of who we are as an institute, as Dr. Alfonso mentioned, one of the leading eye institute in the country for so many years, we have a lot of unfortunately very frustrated patients because macular degeneration is a disease that can really rob you of your central vision, and people are frustrated and they come to us for solutions. And so for the audience, stem cells are cells that are at a very early stage and can differentiate into any type of cell. And so the hope would be that you could replace the cells that have been damaged in your macula with stem cells. And unfortunately, as Dr. Lam mentioned, we are still in the very, very early stages of this for macular degeneration. We have many other great treatments for macular degeneration that are safe and effective, which we can implement. But the caution there by Dr. Lam is a good one. One of my colleagues in the retina department, Dr. Thomas Albini, unfortunately, was able to report on a series of patients that were desperately seeking treatment and went to an unapproved stem cell clinic. And unfortunately, in an attempt to seek vision restoration, many of these patients lost vision. So I encourage everybody in the audience that if you have a severe eye disease that you have sought multiple opinions for and nobody's been able to provide treatment, please consult with either ourselves or another reputable institution before you seek stem cells as a therapy, because as of yet, unfortunately, stem cells are still, while a lot of research is being done, including at our institute at Bascom Palmer, they're still a ways away. And there's several other very safe and effective therapies that we can try before you seek these experimental therapies.
Thank you, Dr. Fortune. Dr. Alfonso, is Bascom Palmer an academic eye center? And if so, what does it mean for the patient?
We are an academic health center, part of the University of Miami and the Miller School of Medicine. And this is a wonderful thing. And every one of our faculty members have dedicated their professional life to working at this academic center because it is filled with new knowledge. So what this means is that when you come in as a patient to Bascom Palmer, you're being cared for by a team of experts, and that includes very, very bright students who are always asking out of the box questions to make sure they challenge standing knowledge. And that is a very important part of the care of a patient. You have faculty members who have an enormous amount of experience and are respected worldwide for this experience. Then you have researchers who are looking to find what are the best ways and newer ways of treating multiple different eye diseases. And then on top of that, you have a dedicated team of staff and professionals who do the same thing day in and day out. And for that reason, when you look at statistics of outcomes of patients that have different diseases that require treatment, Bascom Palmer always ranks #1 in having the lowest complication rate, has the best safety profile for patients, and this is what being in an academic health center is all about. A conglomerate of all these things.
That's
And
again,
add to that really quickly. Is that okay, Tony?
yeah, it's more than fine, doctor.
Okay, so I'm sure all of us get this all the time. You know, we have patients referred from everywhere to us, and they always say the same thing. My ophthalmologist said this is outside of his purview, and he sent me here to deal with it. Is this something you guys can do? And you know, my classic answer is always, don't worry, you are never the worst set of eyeballs we're seeing at Bascom Palmer. we always see the worst stuff ever, so nothing phases us anymore. So yeah, I mean, it's just a funny story, but it makes the patients feel so much more at ease when we say that, where we're not stressed out or you know, afraid of what we're seeing.
Well put. Well put.
Silver lining.
Dr. Fortune, with a family history of wet macular degeneration, what preventative steps can one take to minimize risk? And then the next part of that question is, and what advancements are being made in the treatment of dry macular degeneration?
Yeah, that's an excellent question, Tony. And I think, as we mentioned before, you know, macular degeneration is a disease that runs in families. It's not a straightforward genetic disease like so many diseases where you can say, you know, you have a X percentage chance of getting it. So just because somebody in your family had macular degeneration doesn't necessarily mean that you're going to have macular degeneration. But certainly the first step in prevention is to visit an eye doctor and to either visit, you know, a general ophthalmologist or a retina specialist to see if you have macular degeneration. And usually the macular degeneration that we're talking about is, again, age-related macular degeneration. So an eye exam after the age of 50 is warranted. If there is no evidence of macular degeneration, there's no therapy or medicines that can be taken to prevent it, as we mentioned before. A healthy lifestyle involving smoking cessation, a healthy diet, exercise, taking care of the rest of the body can certainly help maintain eye health. But there's nothing, in fact, that unless you have a diagnosis of macular degeneration, that can be done to prevent macular degeneration. So the first step, as with many eye diseases, going back to what Dr. Habash said, because many of these diseases are silent, is to get an eye exam. Once that's done, then a diagnosis is established, then we can institute all these sort of preventative measurements. You mentioned dry and wet, and I'd like to very briefly explain to the audience that dry macular degeneration has nothing to do with dry eye, as Dr. Habash was alluding to. Dry macular degeneration is sort of an older term, a colloquial term that we still use, which refers to the slow, progressive wear and tear of the macula or the retina because of aging. It's called dry because there's no abnormal blood vessels. The abnormal blood vessels are created by the body in an attempt to repair these tissues, and that can lead to what we call wet macular degeneration. And again, wet does not refer to your eyes tearing. It's just, again, a colloquial term, a layman's term that we use to refer to that stage of macular degeneration where the body, in an attempt to heal itself, creates these abnormal blood vessels that can then leak fluid or bleed, which in turn, because the retina does not like fluid and it's not like blood, can then lead to vision loss. Up until about a decade ago, a diagnosis of wet macular degeneration, unfortunately, was a sentence to loss of vision. thanks in large part to some of the work that was done at Bascom Palmer by folks like Philip Rosenfeld, we have been able to develop drugs that can be injected into the eye and prevent the abnormal growth of these blood vessels. And whereas before nearly 100% of individuals who had wet macular degeneration and lost vision, thanks to these injections, nearly 100% of individuals will maintain the vision that they come into the office with, and 30 to 40% of individuals will see significant visual gains. So now that we've sort of, conquered, if not conquered, but very well treated wet macular degeneration, we have turned our efforts to dry macular degeneration, because even though it's slowly progressive, it is still a significant cause of vision loss. And at our institute here at Bascom Palmer, we are running several clinical trials, including at our Lois Pope Research Center, which is based out here in Palm Beach, where we're doing some cutting edge clinical research, where we're looking at medications that can prevent the progression of dry macular degeneration. And I'm happy to report that many of these drugs are now in what we call phase 3 clinical trials, which means that they are very close, if they show positive results, to being approved by the FDA for commercial use. So certainly the future, as it relates to both wet and dry macular degeneration, no pun intended, is very bright.
Thank you, Dr. Fartun. Interesting. Every question and answer becomes more and more fascinating here. Dr. Habash, this was sent in. Does high blood pressure affect IOP?
No. So IOP is intraocular pressure. That's the pressure inside the eye. And it's kind of fascinating because the eye is, we call it immune privileged. So it's kind of separate from the body. Even if your blood pressure is high or low, it really typically doesn't affect the eye. I mean, there are some extreme cases. It doesn't affect the pressure of the eye. There are some really extreme cases where it might, but no, it doesn't typically affect the intraocular pressure. Now, I will say, if a patient has uncontrolled hypertension or high blood pressure, that can affect the retinal vessels in the back of the eye. And that's actually really interesting, because the retinal vessels in the back of the eye, Dr. Fortune can elaborate on this a little bit more, they're sort of the same caliber as the blood vessels that are in the kidneys. And so when you have something like diabetes or high blood pressure that are affecting the rest of your body and the kidneys, we can often see it first in the eye because of the small caliber of these vessels. I think you're muted, sorry.
Dr. Alfonso, this was just sent in. If you see very small floaters when reading, what is this called? And at what point is it imperative to see an eye doctor?
So that's a very good question, because it's a very common problem. And it's not a disease per se. So as we age, the jelly inside of the eye, which is called the vitreous, starts to move from being a jelly to being a liquid. And when it does that, it starts to detach from the back of the eye, or the area where the retina is. These detachments are seen as little particles inside the eye, and these are the floaters. The Egyptians used to talk about this as floating flies, and that's why Cleopatra had so many people fanning away the flies that were not there. So one of the things that we all try to do is to catch these flies that are just all over the place, these spider webs, and that tends to happen more after the age of 40, and more likely on patients who have myopia or nearsightedness. Again, it's a very common condition. It is not a disease per se, but it could be a warning sign of a retinal detachment. So if you get floaters that are decreasing your vision, or if you see flashing lights after you get the floaters, you start seeing flashing lights that are not there, that could mean that there is tugging of the retina by this detaching vitreous gel. And you need to be seen very soon, within 24, 48 hours, to make sure that there's not a retinal tear that Dr. Jorge Fortune needs to treat. Because treating those small tears can prevent further detachment of the retina. But chronic floaters are there for many of us. We get them in both eyes. Some patients are so bothered by them that they have come to us asking us, can I have the floaters taken out of my eye? And at times, some eye surgeons have used a vitrectomy, which is a type of surgery to remove the jelly from inside the eye, to remove floaters that are really, really symptomatic. But we tend not to suggest that because any one of these surgeries can lead to more complications. So live with your floaters. They're nice flies and spider webs that want to be with you. Don't get rid of them.
I just need someone to fan them away like Cleopatra. Dr. Alfonso, since I have you here, I have to ask you this. What options do I have if there's an eye concern, but I want to avoid the ER? Can you really do an eye exam if we're not in the same room?
Sure, we can. And let me visit our emergency room right now. So we have the only eye emergency room in the southeastern United States. And this is an eye emergency room dedicated only to eye emergencies. So you're not going to go there and see people with heart attacks or automobile accidents, et cetera, et cetera. So you're going to be taken care of very quickly. And this eye emergency room is in our Miami location. We also have in all of our locations urgent visits. So you can, if you have an urgent condition, you can go to any one of our other facilities during working hours and be cared for that same day. We also have a virtual emergency room. When you call our appointments number and you say you're having an eye emergency, you will be given the option to have a telehealth appointment. And this means that we will talk to you on the phone, a physician will talk to you on the phone and determine whether you really need to come and see us right away or not. And this in itself can eliminate about 80% of the eye urgencies or emergencies that we see. So we can take care of that. Now, can we do a complete eye exam in a virtual telehealth environment? Not a complete eye exam, but enough to determine if that emergency condition needs an in-person visit right away. Certainly, there are some emergencies that are very critical to be taken care of right away. If your eye is bleeding from any trauma, or if you have a sudden loss of vision, and I mean real significant loss of vision that doesn't get better, then it's probably a very good idea to visit our emergency room.
Dr. Alfonso, thank you so much. Dr. Lamb, we touched on this a little bit ago. Do vitamins for your eye really help? And how about eye exercises?
Well, I think vitamins, as Dr. Fortune alluded to, there are some studies that have shown to be helpful in certain conditions. But I think in general, extra vitamin in a person with a good diet is probably not absolutely necessary for ocular health. I do think that there are also some instances, maybe too much vitamin can actually be a little bit harmful. For example, if a person takes so much vitamin A, then your pressure inside your head could go up. And there are some inherited retinal disorders where there's too much vitamin A may in fact be harmful, but those are probably pretty rare. So I think in terms of vitamins, if you have a good healthy diet, even a variety of food, then I think that's really good enough. Now, eye exercises, I think there are circumstances where you have a young child or you have a younger patient who may have the eyes are not being perfectly aligned, and you could have some exercises that can help them. But I think for the most part, in most cases with ocular conditions, you don't really need to have exercises for your eyes because just with our daily activities, driving, reading, using the computer, we're really exercising our eyes enough.
Dr. Lamb, I'm going to keep you here because we just had this sent into us. Can an elderly patient gain visual acuity in a weak eye?
If you're talking about someone who may have a weak eye since childhood, then I think that's quite unlikely. Now, if you're talking about a weak eye that refers to eyes are not straight and this eye sort of wanders out, that may be difficult. So I think it really depends on the underlying condition, what a weak eye is.
Thank you, Dr. Lam. Dr. Fortune,
Yeah, Tony, I'll add something to that because I think it's important to also underscore that if you have your two eyes working, your stronger eye is always going to take over your vision and direct that vision to your brain. So your brain is going to want to have the stronger eyes. Like when you have a weak arm and a strong arm, you're going to reach for things always with your stronger arm. But we have seen patients who have lost vision in their better eye. And when that happens, what had once been their weaker eye now becomes their stronger eye. The eye seems to want to see more because the brain is asking that eye to see more. So there's always hope for those people who have a weak eye or a lazy eye to see better out of their weak eye.
great. Thank you for that, Dr. Alfonso. Dr. Fortune, is wet macular degeneration usually bilateral?
Yeah, it's a good question, Tony. Macular degeneration, by its very nature, it's a bilateral disease. Now, I'll get to the specific question of whether wet macular degeneration is usually bilateral. But macular degeneration, which always starts off with that dry form that I talked about, is always bilateral. Now, the eyes may differ in the speed of progression, so that you may have one eye that's certainly much more advanced than another eye, but it's usually bilateral. And we know from studies that if an eye has turned to the form of wet macular degeneration and the other eye is still dry, that over a course of about 5 years, the chances that that fellow eye or the contralateral eye will turn wet is about 50%. And so one of the things that we do is anytime a patient comes in to have their wet macular degeneration treated with the injections of the medications that I referred to earlier, is that we always scan the other eye with a technology called OCT, which, Dr. Alfonso thinks I'm probably bragging too much about our institute, but it's a technology that, was developed by one of our past chairmen, and is a technology that has continued to be developed here at the Bascom Palmer, that allows us to see wet macular degeneration oftentimes before it even develops. I talk to many of my colleagues, and they're often jealous because at the Lois Pope Center, where I work at, the Lois Pope Center for Macular and Retinal Degeneration Research, we have 3 such machines where many eye institutes don't actually have any of them. And so this technology allows us to detect macular degeneration, particularly wet macular degeneration, at a very early stage before the eye becomes involved.
Thank you, Dr. Fortune. And Dr. Alfonso, you mentioned a lazy eye just a minute ago. So this was just sent in. Are there any advancements to reverse vision loss in a lazy eye?
Typically, if we detect the lazy eye at an early age, we can reverse it. So there is plasticity in the brain, meaning what the brain develops like before the age of 7. And so if we can detect a lazy eye before the age of 7, we can usually reverse it to a great degree. And this is why Bascom Palmer, one of the things we do in partnership with Collier County, Palm Beach County, and in Dade and Broward County with the Miami Lighthouse, is we screen children for vision problems before the age of 7 at their school age. And we actually have a program where we provide these children free eyeglasses, 2 of them, one for school and one for home, because we know that from past experience, if we gave them 1 pair of glasses, they would lose them for the rest of the school year. So we give them 2 free pairs of glasses. And this is one of the community services that the University of Miami and the Bascom Palmer Eye Institute is very proud to provide in these counties. Now, for adults, there are some training that can be done, like Dr. Lam was saying, to help a little bit in improving the lazy eye. But usually the brain, like I said before, is going to pick the better eye. And so when you try to look with one and the other, you will see that your brain will pick your stronger eye.
Dr. Alfonso, thank you. Dr. Habash, can we reduce the chances for cataract development?
Okay, this is a very good question, multifactorial. So cataracts, the way I explain it to my patients, going back to the whole, practical analogy thing, this is kind of like having a window in your house for 50 or 60 or 70 or 80 years without Windex. So it's normal for it to get a little bit fogged up over time. And that's what causes the vision to be blurry. Some things, maybe wearing sunglasses in your youth can deter the formation of cataracts over time, but generally speaking, I mean, this is just wear and tear sort of thing. And just imagine just having like a window in your house for that long, it would normally get a little bit, yellowish or fogged up. But here's the bright side. So the nice thing about it is that we can be construction workers and we remove the cloudy window from the eye during cataract surgery. We can replace it with a brand new clean one. But not only does the clean window or the implant give you clear vision through it, but it also corrects the prescription of your eye. Because now this new clean window has your glasses prescription built inside it. And we can do some really amazing things now. We can even correct astigmatism, and we can also do progressive types of lenses that give you far, near, and computer vision as well. So it's really fantastic. And, I have so many patients who come in and they're so fearful. They say, oh my God, don't tell me I have cataracts. And then by the end of our discussion, it's like, sign me up. Like, where do I sign? Let's do this. Let me get rid of my glasses. And I always say it's never that you're going to get rid of your glasses. There's definitely no perfect solution, but we can significantly minimize, your wearing of glasses for many things. And especially for patients who are super dependent on their glasses, it's a great thing. Going back to what Dr. Alfonso said, what I always say to my patients is, if it doesn't bother you, it doesn't bother me. Unless you're like illegal to drive or something like that. But other than that, we really don't want to do anything, even though the risks are very small. We still don't want to do any surgery unless we absolutely have to. So if it's bothering you, then these are the great ways that we can take care of things.
Great, thank you. And speaking of Dr. Alfonso and Dr. Habash, our next question is actually for the both of you. And the question is, are eye stents for glaucoma recommended? Dr. Alfonso, we'd like to hear from you first.
Sure. So depending on the condition of your glaucoma, eye stents may be recommended. And it's one of the many different therapies that patients who have glaucoma can undergo. We developed at Bascom Palmer one of the stents that has been used worldwide, and stents are very effective. So yes, but let the glaucoma specialist who's taking care of you make that decision. Don't force that decision upon anyone. Don't go and say, I want a stent, because it may be that your eye is not just the right eye for a stent. And your desire to have a stent may cause problems to your eye. Dr. Habash, anything you want to add about that?
I think you covered it really well, but going back to the continuum of how we treat glaucoma, we always do the low-hanging fruit first. So the first thing we would do is an eye drop, and then second thing is a laser, and then we go to something more surgical like a stent.
Dr. Habash, Dr. Alfonso, thank you very much. Dr. Fortune, what causes retinal detachment?
Yeah, this is a great question, because I think that the common theory is that if you have a retinal detachment, you're a boxer or a mixed martial artist, or you've suffered some sort of trauma. But it's actually a very common condition outside of that. And actually, those cases make up a very small minority. The most common way that a retinal detachment happens is actually oftentimes because of aging. And Dr. Alfonso was referring to floaters before. And the way that floaters happen is because the gel in the back of the eye, called the vitreous, which is perfectly gel-like as we are all born, during the course of accumulating birthdays, as I like to say, not aging, it's a bad term, but accumulating birthdays, that gel becomes more liquid. And as it becomes more liquid, it starts to pull away from the back surface of the eye. And depending on the anatomy of your eye, as that gel pulls away, it can tug on the retina. And the retina is very fragile tissue. It has the consistency of wet tissue. And as that gel pulls away, it can create a break or a tear in the retina. And I always describe to patients that this is like creating a tear in wallpaper. And if then you allow that fluid to get through that tear, it separates that tissue from the eye wall. And that is what a retinal detachment is. And the retina ideally needs to be attached to the eye wall in order to function properly. And so really, most of the time, it's a process of aging. Now, we see retinal detachments as well in young people, and that usually has to do with some sort of hereditary or family history of retinal detachments, the way that their eyes are built. And then the other very important form of retinal detachment is retinal detachment that happens because of scar tissue. And oftentimes we'll see this in very, very young infants, in premature infants. It's something called retinopathy of prematurity, which we have a very, very robust department here at the Bascom Palmer that screens children in neonatal ICUs. And also, scar tissue can be formed in patients that have diabetes and diabetic retinopathy, because they get bleeding in the eye that leads to scar tissue formation that can then detach the retina through a mechanism we call traction. And so most of the time, again, not related to trauma, several different reasons. And so certainly if you are diabetic, please make sure that you get your eyes checked on a yearly basis. And if you experience a large amount of sudden floaters that's associated with any sort of flashing lights, please go in and see your ophthalmologist so that they can do a thorough exam to determine if you may be at risk for a retinal detachment.
Thank you, Dr. Fortune. And Dr. Habash, we're going to come back to you because this just came into us. If an intraocular lens fails, can it be replaced?
It can, but we really don't have to do that. I mean, I don't really see much of a reason for it to fail. And we know that at the time of surgery, honestly. So we deal with it. Going back to kind of the way we do things here, if we're just changing the window inside your eye, your window sits in a little windowsill. And so when we put the lens in, the lens has the consistency of a gummy bear, and it sits right in that same windowsill. And it really shouldn't move or change. It kind of scars into place like that. So, if it doesn't fit, if it's not working properly or something like that, we're going to know that at the time of surgery, and we're going to make some adjustments. So yes, I mean, the technical answer to the question is yes, we can, but we rarely ever have to do that.
Great. Thank you, Dr. Habash. Dr. Alfonso, this question just came into us. What have we learned over the past decade about laser vision correction and its risks and benefits over time?
Well, if I told you 30 years ago that I was going to take a laser or a blade and cut into your eye so you could get rid of your glasses and contact lenses, you would say, Dr. Alfonso, are you crazy? I'm not going to let anyone get close to my eye with a blade or a laser and cut into it. But this is what we do with LASIK refractive surgery. And it's become extremely effective and safe over the last 20 to 30 years. Bascom Palmer has been at the forefront of research. And by the way, the Bascom Palmer Eye Institute has the multitude of instruments that are tip top in the field for doing this type of surgery in a safe and effective way. The key to having this type of surgery is a good evaluation before the surgery. Most of the complications we see from this surgery is because the patients did not get an appropriate preoperative evaluation to make sure they were the right candidates to have an excellent outcome. True, complications can happen, like they can happen in any surgery. They say that the only surgeon that doesn't get a complication is the surgeon that doesn't operate. But we can really minimize complications to a very, very low level in refractive eye surgery or LASIK surgery. So yes, if you cannot wear or do not want to wear glasses or contact lenses, look into refractive surgery or LASIK surgery. It may be right for you.
And Dr. Alfonso, after hearing about all these advances, can you share what the future has in store for ophthalmology patients?
Well, as you heard from our experts, there are a number of things. Artificial intelligence will assist our patients to see better and improve the quality of life in the very near future. We're going to continue to do research in stem cells and gene therapy. And this will help patients with things like you've heard, macular degeneration and glaucoma. And a very aggressive goal of ours is what you mentioned, Tony, which is the transplantation of a whole eye. And I think that we're going to be able to do this in the very near future. And this is all made possible by an incredible collaboration of many teams across the University of Miami. And we're very proud that we have a great university in our community that can bring to patients all these great advances. And Tony, I'm just going to mention a couple of other things that we might have missed. One, that we have specialty programs at Bascom Palmer. We mentioned briefly the pediatric vision program. It's one of a kind worldwide. It has pediatric glaucoma, retina, cornea, genetic experts that come together and take care of children. And what we do with newborns that have lost a vision in one or two eyes is amazing. We also have a sports vision program, and you're going to love this. We make baseball hitters see the ball better. So our sports vision program works with athletes at all levels to try to improve their vision. We have an enhancement of vision program in collaboration with the Miami Lighthouse. So this used to be called low vision, but I call it vision enhancement because it's for those people who cannot get 20/20, and yet we have other ways that we can help them really do all the activities that need to be done. Lastly, is we have one of the world's best electronic health records at the University of Miami, and Bascom Palmer is so proud that we worked hard to create a section of that electronic health record called Kaleidoscope. And with that electronic health record, we have improved patient safety, outcomes, research, and education. So a lot more to come. Just remember, Bascom Palmer is only 60 years old, so we got a lot to go.
It's amazing. The information is amazing. And any final thoughts before we close, Dr. Alfonso? I know you've told us a lot, but there may be some final things that you'd like to tell the people who are with us tonight.
I get it, Tony. The bases are loaded. Eddie Alfonso is coming to bat, and you've asked me to hit the grand slam, right? So, yeah.
I have asked you to hit that grand slam, and where were you 50 years ago when I could have used you, when I could see that slider coming in a little better?
So, this has been a wonderful discussion, Tony, and thank you so much for moderating. Everyone has had a lot of fun participating, and we really appreciate the opportunity to answer your questions and all the things you do and we try to do to support our community. I want to thank the U Board of Trustees, the leadership of the university, the faculty, staff, and more importantly, our loyal donors. Without philanthropy to help in many of these programs that we have, we would not be able to get things done. To conduct cutting edge clinical care, research, and education, we need the help of our donors. And all of you inspire us to go above and beyond to find solutions that make a difference to the lives of hundreds of patients. So thank you for sharing your time with me today. And let's go get that 20/20 vision. So from now on, we're going to call every year 20/20 plus 1, 20/20 plus 2, 20/20 plus 3, etc. So thank you.
I like it. Dr. Alfonso, thank you. Dr. Habash, Dr. Fortune, Dr. Lamb. What a fascinating evening. And I think we can all agree that as UM graduates and supporters, we are surrounded by not just great doctors, but extraordinary doctors at Bascom Palmer. I sort of like to think like we just watched the Mount Rushmore of vision care in the country today. We want to thank you all for participating in tonight's final In the Know Town Hall for this calendar year, but trust me, we're already working hard for 2021. And please remember that a full recording of this program will be posted online. You can look for that link in the coming days. And if you would like to, as Dr. Alfonso alluded to, give to Bascom Palmer Eye Institute. We'll have those details for you in an email tomorrow. And in a moment, you're going to get a survey about tonight's town hall on your screen. Please take a minute. It doesn't even take that long to submit your feedback, because what it does, it helps us understand your interest and it improves our program. 2020 has been an unprecedented year, to say the least. We are so thankful for all of you who have joined us through our series of In the Knows. And as we celebrate this holiday season and now the first night of Hanukkah, Let's all remember how, despite what's going on around us, how blessed we truly are. And for that, we need to be grateful. You know, there's an old saying that goes like this: enjoy the little things, for one day you may look back and realize that those little things were really the big things. So on behalf of all of us here from our In the Know series, we wish you a healthy, safe, and happy holiday season. And remember, it's always about the you. Good night, everyone.